Hello, this is Dr. Stanley Lang, and welcome to this video. The topic is the most overlooked cause for back pain. So one of the things that I see a lot of as a family doctor are musculoskeletal issues, and the most common one is back pain. And one of the reasons that I wanted to share about this particular subject is that I saw two people in the same day with the same issue. So I thought I'd give you this little hint on something that you can do right away to check to see if this could be an issue for you, especially if you've got back pain. And quite a few people do, at least some of the time, and some people have it almost all of the time. So one of the things that people don't look at when they're thinking about their back is what's going on with their feet. And the feet are actually one of the major reasons that people have back pain. And the way that that happens can be from multiple different causes. Anything that affects the gait actually can cause or aggravate back pain. I'm not going to get into all that stuff because it's way more complicated and I can't really demonstrate it very well on the video. But there is one thing that is sort of easy to understand and easy to fix. And that is a condition that's called overpronation. So overpronation is when the foot collapses and goes too much like this. Some people will call that flat feet, but it's more than just being flat-footed. It's a motion of the foot. So if you imagine that this is my foot instead of my hand, and this is my heel, when the heel strikes for an average walking step, you have a heel strike, then the outside of the foot kind of goes like this, and then there's this slight roll, which is called pronation. That's supposed to happen. And then for most people, they toe off like that. So there's this heel strike, slight roll of the foot, and then a toe off, and then you move on to the next step. So overpronation is when you have the heel strike and then the foot rolls too much like that. And when the foot rolls like that, that's called overpronation. And what that does is causes a lot of stress to the whole leg as it tries to stabilize your knee. Because when you go like that, the knee wants to sort of be pulled along with it. In other words, the knee goes to the inside more. Well, the body doesn't want it to do that, so the muscles around the knee pull it back. And so that causes different muscle stresses all the way up into the hip and then up into the low back. Actually, this affects the neck in a lot of people, but for the purpose of this discussion, one of the places that people have a lot of symptoms is in the low back area, particularly the sacroiliac area, and then the lowest part of the lumbar spine. And when I examine people that have low back pain, I always look to see what their feet are doing. And very frequently, the feet are doing this overpronation thing. Now, if you're overweight significantly, you're more likely to be pushed into this overpronation pattern. And if you're out of shape, then you're more likely to do that too. And that's true of an increasing number of people. So what do you do about this problem? Well, there's some really neat exercises that you can do that will help, which I'm not going to talk about. And there's a really neat way of learning how to walk, which is called Qi walking, which I'm also not going to talk about, but you can look it up if you want to learn how to do basically change how you're walking to control this overpronation issue. But the simplest thing to do is to get what is called a motion control shoe. So a motion control shoe keeps that foot from going too much like that. And when you're doing this pronation, it keeps it from rolling too far. And so it keeps the foot more level, which then keeps the stresses going up your leg to be more balanced the way that your body was designed to do. So if you're having back pain, check to see if your feet flatten out too much. Just when you stand, like if you stand and put all your weight on one foot, if it kind of flattens out like this, chances are you're overpronating. And you can also check to do that by stepping into something wet and then barefoot, seeing what kind of what happens to your foot when you step on it. If it all flattens out, you're probably overpronating. Now, it's hard to make this self-diagnosis without somebody looking at you, but chances are pretty good that that's what's going on if what I just described is true. And the simple solution is getting a motion control shoe. Now, you may have a shoe store near you that sells those kind of shoes and fits people. And we're fortunate that within driving distance of my office, there's a really good shoe store that they actually watch people walk in the shoes to make sure that the foot is in balance. But most people don't have that. So I recommend getting your shoes from a place called Road Runner Sports. It's a national online shoe store, has been around for decades, and they do a really good job of fitting you over the phone, and they have a really liberal return policy if the shoe doesn't fit. So if you've got back problems, consider your feet in addition to the other usual suspects for your back. So I wish you well. Hope this is helpful. God bless, and have a great day.